Today is May 10th, 2025. I am Arro Smith. I'm here with Dr. Thomas Smith. This is an oral history interview for the Memory Project, LGBTQ History in Austin, Texas. All right. Welcome. This project is about gay history in Austin, Texas. That will be the focus of this interview, I hope. But to ground it, I want to know a brief biography of who you are, where you came from. What I like to do is imagine you have your birth certificate in front of us and tell me what's on that birth certificate. Your parents' names, the place, a general idea about the date.
Okay. I was born in Bellefonte, Pennsylvania, which is next door to State College, which at that time didn't have a hospital. Both my grandfathers were professors at the Penn State University. My mother was right out of high school, 17. Her parents had just moved away. She was a little wild, according to my grandmother's memoirs, and she decided she wanted to get married. My father had joined the Navy right out of high school at the age of 18 because World War II was going on. He was in the Navy, the theater in the Pacific, and when he returned to U.S. at age 22, he was attending the Penn State University, and he and my mother got married. She at 17, he at 23, and I was born a year later. Then my father joined the Air Force. We moved to Texas, where I was raised.
What city in Texas?
We lived in Pasadena, Waco, and San Antonio.
Wow, okay.
This was in the 50s. In 1958, while it was still a territory, we moved to Hawaii, lived there for 4 years. Then we moved to Charleston, South Carolina, and then to the District of Columbia area, where I attended high school. I attended 13 different schools and really didn't have many friends when I was a child. I attended the University of Virginia, where I did have a lot of friends, and went to medical school there, graduating in 1975. So this month is my 50th anniversary of being a physician. After that, I did my residency in family practice, which was a relatively new area of residency at that time. My friends were back to the country people, and I decided to start an office with a partner in Parisburg, Virginia, a town of 2,500 in a county of 17,000. And was in practice there for 7 years. I enjoyed Parisburg, but I was dealing with the fact that I was coming out to myself as being gay and getting out of denial. I had a sister that lived in San Francisco, and when I would visit her, I could see that there was another world out there. So I made the decision in 1984 that I was going to move. I wasn't sure exactly where. My criteria were a small university city in the South with a good climate. And I saw an ad for a position with a out gay doctor in Austin named Phil Richardson, and went down for a visit. When I arrived, it was Aquafest. So I walked out of my hotel, then the Sheraton Crest, and there was a raft race going on where people were floating down the river on anything that could float. And I thought, what a great town. And then I met Dr. Richardson, and I decided, okay, I'm going to move to Austin.
Okay. Your sister was living in San Francisco. Why? Why was she in San Francisco?
Well, my sister, Peg Smith, who later went on and opened Cowgirl Creamery, had dropped out of college in her third year and was traveling the country with a woman that was then her lover, although I didn't know that. And I went out to visit them.
You were both closeted.
Yes.
Okay.
But we had a younger sister
Uh-huh.
that was the first to come out. And she came out blazing.
Ah.
So she went to rehab and came out lesbian. So I went to visit my sister Peg, and they were living in the Sunset, which I thought was, wow, you're right at the beach. What a great part of town. Of course, it's actually the least desirable, and because of cold and fog. And she and her lover at the time were sharing a room because they hadn't fixed up the other room yet.
Huh.
And so I didn't realize she was gay. I was very naive. I still am somewhat. And but I could see there was a vibrant gay community, and that there were alternatives.
Okay. All right.
I made several subsequent trips to San Francisco and became acquainted with gay people there. I went to a meeting of the Bay Area Physicians for Human Rights, one of the first gay doctor organizations. And I also met the first...
Was that Bay Area Physicians for Human Rights, that was coded in a way that you
Yes.
understood what it meant, but other physicians probably wouldn't. Is that true?
Well, in San Francisco, they would be aware what it meant, because San Francisco actually had a openly gay medical community.
Okay.
It's one of the first places in the country where you could be openly gay and be a physician.
Okay.
But there were other groups that were called human rights. There was Capital Area Physicians for Human Rights, and there was one in Boston. I don't remember the acronym, but it was similar.
So you have a taste of what could be in San Francisco with your sister, who you do not realize is a lesbian at the time. You know you are gay. How did you know you were gay, and when did you know?
Well, that's always a difficult question to answer. I knew I never really had an attraction to girls.
Right.
And I did have an attraction to men like Bat Masterson and Davy Crockett and some of the others, Steve Reeves, who were all stars at the time.
Right.
And so gradually I was very naive, as I mentioned. I didn't understand. I came home once when I was 12 years old and told my father a joke I'd heard, and I didn't understand it. And he had to actually tell me literally birds and bees, which I found shocking. So you can see I didn't have a lot of friends, so I never really had anyone to learn things from.
Okay.
In any event, I had my Bat Masterson cane to walk around the neighborhood, and I had my first bicycle was a Davy Crockett bike, turquoise blue with fringe. I loved it. So I always knew I had different tastes. I used to make cut out pictures from magazine and build fancy houses, with different rooms. And I would play with my knights in armor, and when I was a smaller child, I remember asking for a doll for Christmas, and my mother's look told me I couldn't ask for a doll. So I changed it to a jump rope, because boxers use jump ropes.
Right. Yeah.
So I could get away with that.
Okay. You went to medical school at a time when homosexuality was considered a disease.
Yes. Well, when I was in college, I would go to the library and look up texts that dealt with homosexuality. I would never check them out, of course, but I would read them, and it was treated as a disorder. I remember listening to two psychiatrists talking to each other and saying that if someone didn't get therapy and by the time they were 35, they weren't going to be able to change. And I thought, well, I still have, 10 years. So I might be able to afford it by then. So I did have one transient, unsatisfying gay experience with an anonymous person in college, and just one or two when I was in medical school. So other than that, I concentrated on my career. I concentrated on studying, and then I did my residency in family practice, which was a new field at the time. They weren't, before that, people just went into general practice without residencies. That was in Newport News, Virginia. I hated that town. During that time, Sergeant Maklovich, the first actively military person to come out nationally, came out, and they had photos in the article about a gay bar in Norfolk, Virginia. And first of all, I was kind of surprised to know there was one there, but I never went. And consequently, by the end of my residency, I went into a bad depression. I didn't seek treatment. I never asked for anyone's help. Throughout my life, my parents never really gave me advice of what to do. I had long decided I was going to get my doctorate in something. I planned originally to be a chemist, and then I became interested in medicine and had received my doctorate, but I never talked to anyone about personal issues. And during that period, I had to choose where I was going to practice. And one of the fellow residents was moving to a town called Pearisburg, Virginia, a town of 2,500 in a county of 17,000. And I decided to go into practice with him and his wife, who was a nurse practitioner. And the three of us set up a practice in Pearisburg, where, because of the retirement of another physician, we got the cream of the crop right off the bat. But we saw everyone. This was a small county. We never turned anyone away. Insurance paid what you billed at that time, and so we could afford to handle the free patients. We actually had what we called a blue dot system. If you didn't want to waste a postage stamp on a bill, we just put a blue dot on their card and didn't even send them a bill. Now, if they were on Medicaid or Medicare, they would consider that fraud because you don't bill them and don't send them to collections. We also ran the emergency room, the jail, medical examiner, industrial physician, everything in the county, and the emergency room.
It sounds like this was fulfilling work for you.
Yes, and I liked Pearisburg. I think if I had been straight, I would have stayed there.
Probably married a nurse.
Possibly, I never thought about, there were some women that were kind of making approaches at me, but I, of course, never picked up on any of that. I did go on one date when I was in Pearisburg. One date, one time. No kiss at the door.
So, after several years of this, you make a decision to move to a new practice, a new town, and to move into to be able to be an out gay man.
Yes. I started to come out during my time in Parisburg.
But what
out of
inspired
town.
you? What inspired this huge paradigm change?
Well, I realized that I could integrate my life if I just had to figure out how to do it. I started dating a man in Roanoke, which was an hour away from Parisburg, and it just wasn't working out. And I was thinking, well, you know, I could keep my house in Parisburg and we could have a apartment in Blacksburg or Roanoke, and you know, I could live a double life. But that wasn't working out, and so I realized I had to move.
Okay.
And so
Would it have been inconceivable to keep your practice there and be an out gay man?
I don't know. I mean, I think actually it would have been easier then than now, because now it's a very Trump area oriented town, and there wasn't as much anti-gay. I think a lot of people in town figured me out, and I knew a lot of gay people in town, all of whom were married. Except one. So one person had to come in and inherit the funeral home business, but he moved in right about the time I was ready to move out. But I actually ran into one of my patients at the gay bar in Roanoke. I started going about 2 years before I moved, and then one night when I had been drinking too much wine by myself at home, he showed up around midnight. And this was a person that was Trouble anyway. He'd been a problem with at the Celanese plant and other places, and so I was very hesitant to get involved with him. And actually I have a regret, because I told him to you know, basically go away, and I think I treated him badly. But in any event, I really didn't have a gay life when I was in Parisburg. So this person I was dating from Roanoke and I went on a vacation in San Francisco. And we were sitting at a sidewalk cafe on Market Street, and I was reading The Advocate, and he was so paranoid, like, you reading that in public. The Advocate is a gay magazine. It's now only online.
It was the only gay magazine in 1980. What year is this?
This was in 84.
84.
There was a magazine called After Dark.
Oh, yes,
That
that's true.
was mostly theater oriented, and that's where I learned about the existence of gay bars. In fact, some gay bars. In fact, the first gay bar I went to was in Orlando, Florida.
You were at a conference.
I was I was on vacation.
Oh, okay.
I drove down. I was going to the Keys. My sister had a condo there, and so I had taken it for a week. And I went to, it's a famous bar. I forget the name of it, though. It was a very, very large one. It had like drag show area, disco area, leatherette area. And in Orlando. And so I went there. I didn't get picked up because I was always waiting for someone to approach me. And usually if they did, I would run the other direction. So, but the next day I went to the Metropolitan Community Church. And this was a church that was founded by Troy Perry in the early 80s, possibly late 70s. And he was kind of a leather man, but he became a minister of this church, which is still active today, and it was a gay church. So in that situation, I met somebody who was my type and spent the night with him. And that's really the first time I'd ever spent the night with someone in bed. And so I found that very satisfying.
And he was a nice boy from church.
Yes, and he professionally he made doll furniture. So I always think of him as Geppetto, but that wasn't his name. And then I continued my drive down to, well, I had the condo on Marathon Key, but as soon as I got there, I realized this is not where I wanted to be. I left and went to Key West and stayed at one of the gay guest houses. And then, I had some sexual encounters there and then stopped by and saw Geppetto on the way back. Never heard from him again. I don't even know if I had any contact information on him. But that's when I realized that I think I was 30 or 31 at this time.
Okay.
So that's when I realized I was, wanted to have a gay life. So it was like 3 or 4 years before I actually moved.
Okay.
In any event, when I was in San Francisco on the trip, I read The Advocate, I saw an ad from Dr. Phil Richardson in Austin looking for an associate, and he mentioned the practice was mixed, not all gay. And that appealed to me because I didn't want to live in a gay ghetto.
Right.
So when I moved, my criteria were a university city, small city, good climate, and I didn't want to live in a gay ghetto. I wanted to live in a town where the gay people were integrated into the society. And I made the decision to move to Austin.
How long did you share that practice with Richardson?
I was in private practice in Austin for 11 years.
And
Phil,
what year did that start? 84?
85, January of 85.
And that is an interesting year to be gay and be involved with the medical community. But continue.
Yes. So he left after 5 or 6 years to move to San Francisco. This had been long planned. But our practices soon went divergent in that he didn't really like to take care of sick people. And I had an interest in HIV. I had heard of HIV, then it didn't even have a name, they didn't even call it GRID.
Right.
I read an article in the New England Journal of Medicine in July of 1981 about a new disease affecting gay people in New York City. Gay people that were getting Kaposi sarcoma and pneumocystis pneumonia. And this was the first time it had been noted medically. However, I remember at least 2 patients that I had seen in the late 1970s that had HIV. They were both obviously gay men. One I treated, he had lymphadenopathy. We did a biopsy, and the biopsy came back histoplasmosis, which is a benign condition, although usually doesn't cause that severity. And I never saw him again. And then there was another that I heard about, some young man dying of some kind of unusual infection of the colon. So, and then I was very interested in that, and when I came to Austin, I saw my first HIV patient in January of 1995. Prior to that, in San Francisco, at the Inn on Castro, I had met a physician, a psychiatrist from North Carolina with AIDS. That was the first person I actually knew with AIDS. And
a physician.
A physician.
So this man knew he was sick. I mean,
Yes.
And was he able to, what did he think he had?
Well, this would be in 1983 or 1984, so by that time they had a name for it,
Okay.
GRID, and they had the name AIDS. They didn't yet call it HIV. So he knew he was terminally ill, and I talked to him about that, but what I was more interested in at that time was how a gay doctor from the South had integrated his life.
And how did you do it?
Well, when I moved to Austin, by the fact that I was in practice with Phil Richardson, everyone knew I was out. I never experienced any prejudice in the medical community. Really almost no prejudice in town. So I was very happy with my life. But when I got here, I wanted to get in a relationship. And I complained to Phil that I hadn't met anyone yet. This was after I'd been in town for 2 months. So I went to he had a party where he mostly invited single eligible gay men. And it was a Hawaiian theme party. And having lived in Hawaii and being gay, I wanted a real lei. So I had the florist make a real lei, which they did very poorly.
Plumeria.
Oh, well, they didn't have plumeria,
Oh.
so it wasn't a very good lei. I knew how to make it. Anyway, that was on a Friday or Saturday, and I met some people there, and on Monday, one of the people, Tom Doyle, called me up, and we set up a date for that Friday. Being from Virginia, I showed up in a coat and tie, ready to go out. With the gay bars. Tom lived at the Railroad, which is an apartment community downtown, and at that time was one of the only apartment communities downtown, and it was very close to the gay bars. He had been married to women twice, and was having gay sex behind their back constantly. But he had really come out about a year before, and so he was kind of ready for a relationship. Anyway, we didn't go out. He had cooked dinner, and so we stayed in. And by Sunday, we were dating each other a lot, and within 3 months he had moved into my house in Tarrytown, and so.
Now, was this when he was an active practicing civil rights attorney, or is this when he was a bookseller, or somewhere in between?
He was a founding partner of a firm a law firm that specialized in school board law.
Ah, okay.
So he had a niche, and they were really the only practice in the state, so they had a lock on those cases, and it was at a time when more and more people were suing school boards. So he had a really good practice, and within a year he decided he wanted to do something different. So he quit his practice, and he opened a bookstore. It was the first bookstore, gay and lesbian bookstore in Austin, called Liberty Books. It was near Castle Hill on Lamar Street. And unfortunately, it wasn't successful. I think one of the reasons was we didn't sell porn. But the bookstore stayed open for a while, and I was still naive. I didn't realize that Tom's back in 5 minutes sign on the front of the door indicated what all was going on with him in the store.
But I imagine that you all were like a gay power couple.
We
You're
were.
a physician and an attorney.
We were
and-
a gay power couple.
Yeah.
I became known very quickly as one of the few people that was treating HIV and AIDS patients. And in fact, I had the largest HIV practice in Austin. And he became, he was head of whatever they call the lesbian gay lobby at the time.
Yeah.
And he was one of the 5 plaintiffs suing the state of Texas over the sodomy law. The case was lost at the Texas Supreme Court. And in fact, sodomy laws remain on the books in Texas. So we were well known. And we were very active in community affairs. If I went to a bar, I always had free drinks. The bartenders all knew who I was. And there were some fun events. There was one at the Waterloo Counseling Center's October Halloween ball. There are a few YouTube videos about that left. But this was the big cultural event. Well, not cultural event. The big fundraising event for the gay community every year. Again, that used to be at the Sheridan Crest, which is now called the Link, I think.
Something it's changed.
So we were very active in, as I was treating people with HIV, I did a lot of experimental drug treatments and new treatments. And
When someone with HIV would show up in your exam room in 1987, how long would they live?
well, I'm going to back up a little bit. In 1984, in connection with MD Anderson, they drew a lot of the blood tests on patients of Phil Richardson. They were trying to develop a test to detect HIV. So in January of 1985, we were the only people in town that had results of HIV. And so I was having to give a lot of people their test results. And I would say about a third of them were positive. So at first we didn't have anything to treat them with. There was some talk about ribavirin, but there was nothing in the medical literature. We could treat some of the infections, sometimes with rather primitive drugs that are no longer used, but we couldn't treat HIV itself. Then AZT became available in 1986, I think, and at that time, one needed a stamp that said you were allowed to prescribe AZT, which is now called Zovirin, I think. And so this was the first drug that had some effectiveness against HIV. The problem was it was only one drug. And at that time, people had huge viral loads. We weren't able to test viral loads initially. And so the drug would become ineffective after a while. We were also using doses that proved to be much higher than were needed.
Toxic.
Yes,
Yeah.
and so people had more side effects. But it did improve life expectancy.
But what was that life expectancy in 1986?
It was very variable. There were people that died within months of acute HIV infection. And there are people that are still walking around now that never got sick with HIV and 10 years later were able to get the nucleoside analogs and the proteinase inhibitors that turned HIV into a chronic disease instead of a life-threatening disease. So it was very variable, but I would say for most people that died, it was with treatment about 5 years.
Okay.
But again, it was very variable. And I had, lots of deaths. The average age was early 30s. And the diseases themselves were really cruel and debilitating. Sometimes people would die quickly from something like pneumocystis pneumonia without having ever been sick otherwise. And sometimes people would just go through the whole gamut of pneumocystis, cytomegalovirus with blindness, cryptosporidium with diarrhea, wasting syndrome, and other things. So it was very sad to watch. For me, it was my war. I hadn't been in Vietnam, and this I was really fighting because we were not only dealing with a fatal disease, we were dealing with prejudice. And there was prejudice against gay people, and there were gay people, and there were people that thought that AIDS was a deserved consequence of their immoral behavior. And then there were other people that weren't anti-gay, but they were very worried about how contagious it was, how safe it was to be around someone with HIV. And as far as the medical community was concerned, there were very few people that were anti people with HIV, but almost all of the doctors felt that they hadn't had any experience in dealing with it, and so they didn't feel that they were capable of dealing with HIV, and so they didn't. I was known at St. David's Hospital for accepting anyone that showed up at the emergency room with an acute AIDS diagnosis. So I got a lot of patients there. A good portion of my patients couldn't pay. We have a program in Austin called MAP, Medical Assistance Program. And with MAP, I was able to cover all their lab work, their medications, and their hospitalizations, but it didn't pay anything for the doctors.
Right.
We also recycled medications. When someone died, we would take the medicine they had and give it to people that needed it, that couldn't afford it, which I think is technically illegal.
Totally legal, and I totally helped with that project.
Yes.
I was rifling through drawers and medicine cabinets immediately after someone died.
And there were, there were ways in which I risked my license, but I felt like I needed to. Like I say, I felt like this was my war. And we used a lot of investigational drugs. Linus Pauling came to my office. We did a study with compound Q to see if that had any effect. It didn't. We did a study with doctors at the University of Texas in San Antonio with the new antifungal drugs, itraconazole and fluconazole, both of which are widely used now. But at that time, they replaced a alternative called amphotericin, which was an IV drug, also known as amphoterrible because of the side effects it had. We used clarithromycin before it was approved in the US. And sometimes we would use what we called buyers clubs.
Yeah.
Now, there was a movie, Dallas Buyers Club, but in that movie, the Buyers Club was making a profit. I was not aware of any Buyers Club in Texas that was trying to get a profit.
Right.
People were doing that on a voluntary basis. And sometimes drugs would become available in Europe or in Mexico before they had been FDA approved,
Right.
and we couldn't get them in the US. Another drug that I used towards the end of my practice with HIV was thalidomide. Thalidomide was basically banned in the US because it caused
Birth defects.
terrible birth defects.
Yeah.
People were born with limb deformities.
It was
And-
used to treat morning sickness for pregnant women
Yes.
before they discovered.
And sleep.
Yeah.
And so this was in the early 1960s that they
Yeah.
discovered. So the thalidomide babies are now around 60 years old.
Yeah.
This was approved for wasting syndrome.
Yeah.
The only place in the US it was available was at the Leprosarium, or the Hansen Disease Center in New Orleans. So I would have to get it specially prescribed and approved and sent in from that.
Huh.
We also did a lot of studies on other antiretrovirals like DDI, DDC, D3. They all had names like that. And all of those were helpful because they could work on people that had become resistant to AZT. But again, resistance developed quickly, so they were only of temporary benefit. I was
So-
also a firm believer in prophylaxis. If someone, say, were from Indiana, they had a 96% chance of having histoplasmosis in their system. We could tell who was prone to histoplasmosis with prior infection with a skin test. But people with autoimmune deficiency don't have any problem with histoplasmosis. So I could give them prophylaxis to prevent it from developing, and we could give prophylaxis for pneumocystis pneumonia as well.
Your practice in Austin it coincided with the bad old days of AIDS
Yes.
for 10 years. And then, what was that like emotionally living through it as a gay man, though? How did that?
Well, it was difficult, but like any doctor that deals with terminal disease on a constant basis, you have to have a little distance. But it was emotionally very hard. And of course, a lot of those people were personal friends.
Yes.
And that made a big difference. I went to a lot of funerals, and but I also made a lot of other friends.
Did it affect your personal decisions about your partners? The relationship with Tom Doyle ended, and you
Yes.
famously carried on with Travis at the very same Sheraton. Is that true?
Well, I'm monogamous, but all my relationships have overlapped.
Okay.
I've been in 3 relationships. With Tom Doyle, after he opened the bookstore and he started publishing and writing, but he was he always procrastinated, and his writing projects were never finished. He got really depressed and was smoking pot all the time, and as was I. But one weekend, I went to a fundraiser in Hyde Park on a Friday night, and I heard there was someone coming in for the weekend, a college student from Midwestern State University in the horrible town of Wichita Falls. And I came home and our garage door opened into the guest room and I saw 3 large suitcases. And it's like, oh, this guy's gonna be here for the weekend. And in any event, his name was Chuck Wendling, and I fell in love with Chuck. For 2 months, we were a threesome. And then Tom Doyle decided he wanted to leave. And I was very upset about that. I was upset with Tom. I felt like he was, he was deserting the relationship before he should have. And also, it's kind of like, suddenly I had this college student living in the house with us, because by that time he had moved in. And I'm thinking, well, how am I going to handle this? And what's it look like? Because he was 19 years younger than I was. And he actually wasn't my type physically or age-wise. I always liked people a little older than myself. But I fell in love with Chuck. And I'm still in love with Chuck. He's my best friend. Anyway, we got into a relationship, and there was a lot of drama with it. We had different expectations of a relationship. And so after 3 years, he moved to Amsterdam. And when he moved to Amsterdam, I told him that if he had to come back, I would pay for it. And so at that time, while Chuck and I broke up, but we were still living together for a year. During that time, I started dating my current husband, Travis Lindenbaum. And and also shortly, a couple years after that, I started going to AA because I was drinking too much and smoking too much pot. And that was after Chuck had already moved. I was living by myself, and I wanted to sneak in the back and not be recognized. In fact, I thought I could go to Waco. No one would know me there. But then I thought, how often are you going to drive to Waco? So I went to an AA meeting, and I snuck in the back. But I remember being recognized by a few people there. And I didn't want people to know so much, because if I didn't succeed, I didn't want people to know that I thought I had a problem. So in any event, on 4th of July, when I was 3 weeks sober, with the fireworks going off, I was driving to pick Chuck up at the airport because he had had a falling out with his Amsterdam boyfriend. And anyway, he came back. He's there for a few months, and then his lover came back from Amsterdam and picked him up, and he went back there, and he's still there today. He's now a cardiology nurse, and as I said, we're very close still.
During those bad old days of AIDS, I had 2 suits, and one was always at the cleaner because I went to a memorial service seemingly every weekend. And I would meet totally hot guy at the bar, spend a wild night, and 3 weeks later, seemingly, he would be dead of PCP. It was a weird time to and homosexuality was still illegal. it was a weird time to be gay and to feel like you know, people were dying because of who they chose to love, and why bother loving, and why, and you're in the middle of it trying to take care of these people that are dying.
Yes. Although I was I was involved in relationships the whole time, so I wasn't out on the dating scene. But yes, I have lots of horror stories I could tell about funerals and families. Also have some stories that are very heartwarming about families.
Looking back, okay, well, let's go to the end of your practice with HIV, which is approximately in 1995.
Yes.
Protease inhibitors are invented.
Well,
We close Christopher House because we don't need it.
January 1995, I went on a vacation with Travis to Mexico, and I think we were gone for 2 weeks. It was a much longer vacation than I had had because I was in solo practice at that point, and there were only a couple people that I could deal with. I need to mention that my call partner, Ken Blair, was the main support. He actually died of AIDS, which he had acquired from a needle stick at the office. He died about 10 years after that.
Yeah.
But I went on this vacation, and I realized that during that I didn't want to do it anymore. I don't like the term burned out, but effectively that's what I was. I was also at the brink of bankruptcy because I was poor at the business side of practice, and I was treating too many free patients. So I had gotten to the point where they were just about to cut off my lab anyway. And I realized that my whole life I had been on a straight course. The university, medical school, immediately going to work, never having taken a break. And at that time I was 46. And so I knew I had to close my practice. I want to mention also that I had a large number of transgender patients. They were almost exclusively male to female. At that time we didn't have as many variations and shades of transgender. So I realized I needed to stop, and I didn't know what I was going to do, but I knew that I was employable. I mean, I had my MD. So I gave my staff, this was in January, I gave my staff 9 months notice. I gave the patients 6 months notice that I was going to be leaving. I was able to place the patients at that point because the patients with insurance now had infectious disease doctors to go to. By this time, AIDS had been around for 10 years, and people had actually learned about it in residency and were capable of handling it. And the patients without insurance could go to the David Powell Clinic. David Powell was one of my patients. He worked for the health department, and he was the only patient on whom I got an autopsy because he specifically requested it. He died in Brackenridge Hospital, and the pathologist actually agreed to do it. Most pathologists wouldn't do autopsies on HIV because it was still infectious and you'd have an accident. I know doctors that, besides Ken Blair, that got HIV from accidents. Anyway, there was a place for them. The only people I couldn't place were my transgender patients. And I always enjoyed working with them. And in fact, when I retired, it was my transgender patients that planned a retirement party for me at the Catholic Church. I think it's St. Ignatius on in South Austin. So I couldn't place them.
And then AIDS went from being a crisis to being a manageable disease.
I closed my practice at the end of October 1995, the same month in which proteinase inhibitors became available.
Right.
So overnight things changed. I remember I had a patient with a T cell count of 9, and death seemed pretty imminent for him. And I retired, and then I ran into him a few months later, and it's like, you're still alive. And it was an overnight change.
Yeah. We closed Christopher House because we didn't need it, and it frankly went out of business.
Yes, I'll mention in I think it was 1987 or 1989. I wasn't a founder, but I joined it soon afterwards. Project Transitions was formed by Michael Fackenthal and Doug Key. Doug Key, by the way, was a very close friend of my sister, Peg. They had gone to the University of Tennessee together and lived in San Francisco at the same time. Anyway, the two of them formed, and a couple other people, formed Project Transitions. And at that time, what it was a hospice where people could die from AIDS. And it was named Doug's House after Doug Key died. And later we acquired an apartment complex, which was basically a waiting room for the hospice. It was for people that were very ill with HIV. And we had medical assistance available for them. And I was on that board for a long time, until I closed my practice. And after the proteinase inhibitors came out, it changed from being a waiting room for hospice into being a residential facility for people with HIV. And it's still, I quit the board when I closed my practice. About 10 years later, I went on the board again. And so I was on the board for another 7 years. And they just opened a new facility. I happened to be in Austin last year when they opened it. So they're still doing their job.
We are approaching the end of our time here. Can you sum up or talk about kind of the arc of what you perceive to be gay life, gay culture from when you first landed in Austin in 1984 to now? What are the takeaways?
Well, at first we were kind of like a semi-secret club.
Right.
And we were a insular community. And that was fun in some ways. On the other hand, there was a lot of prejudice, and you had to deal with a lot of laws, and we're still having problems. We got to the point where gay marriage was legal, and now, of course, they're on a reverse course, starting with the transgender people. But enjoyed that period of time overall as far as gay life goes. Of course, a lot of things have changed, including the fact that I am now 35 years older. So I'm not one that's running around at the bars, on Grindr, but I think the sense of community has decreased a lot, which is good in a way, because I always wanted a community that was integrated to begin with.
Right.
And now it is. But now it seems everybody's gay. Varying shades of gay. At least in the cities here.
We've won.
Yes.
We were right.
I would like to have a time machine. Austin has changed so much. I would like to go back to around 1990, and then I'd like to come back to the present, because they're just different.
Yeah.
And they both times have positive qualities.
All right. Final comments, thoughts?
Well, I don't think I've mentioned my husband enough. Travis and I have been together for 34 years, and we're now officially married. We had to go to New York City to get married before it was legal in Texas. We live in Mexico now, San Miguel de Allende, which I'm very pleased about, but it's fun visiting Austin and seeing how things have changed and how things haven't changed.
Yeah, yeah. Well, it's been a pleasure to sit down and learn about your history in Austin. Thank you so much for joining us.
Thank you.